Good morning, ladies and gentlemen. I'd like to introduce to you the patient monitor in the ambulance. Before, I'd like to introduce to you how this equipment can be removed from its base. There is a screw behind you, either turn it clockwise or anti-clockwise, and it enters into this thread. There's a thread in that hole which the screw is also inserted through to tighten it to hold it firm to the base. Also, this is a port for USB and also the power source where we connect to charge the monitor. So these are the key things I would like to let you know behind. And also the spaces over there is where you insert the screw to tighten the monitor. We also have this the power cord, the black power cord. That's where you insert into the power port and you charge it. But before then, you have to screw it to the base so that it holds it firmly, it tightens it. So you can see it's being screwed, making sure it's firmly hold to the frame so it is well fixed. Now operating it, there's a power button, that's the orange button, and also we have the brightness screen. We also have the status, either a patient, adult, or an unit. To on it, you press the orange, that's the power button, the screen displays. And as the screen displays, we have about 7 sections. 7 sections will display on the screen. The first section, which is the one displaying the heart rate, that's the HR. The one displaying the heart rate. The next one also displays the NIBP, which is the non-invasive blood pressure. That's when you are checking patient's BP, or you press the BP curve to inflate. The readings are displayed there. The next one also is the SpO2. That's the oxygen saturating in the blood, also indicated. The yellow also is the respiration of the patient. We also, when you check also, there is a pink, I would say violet color, which also that's where the temperature also is indicated. The temperature, we have the T1 and T2. That means it uses 2 quarts or pot temperature cables. Okay, you can see also TD, which is the temperature difference. When you are taking the difference with the 2 temperatures. So this is all about for the screen. So we have your respiration, we have a temperature, you have also the 2 bar where you can see patient status, the NIBP, the event, display patient statistics. So the 2 bar will give you the chance to do a lot of functions, or perform a lot of functions, to print out information that you have already acquired through your the equipment. So this is basically what I would like to let you know for now. So you can also see at the left side of the monitor there are some ports where the cables of the monitor are connected. There are about 5 ports or holes at the right side, on the left side of the monitor, where cables are connected. The yellow one, this for instance, is one of the temperatures ports. You can either connect the first one, which is the T1, or the second one, which is the T2, and this is the part which is inserted or placed under the armpit to have the temperature reading. You place it under your armpit to have your temperature reading. So I would like to first, this is currently, since it is not under any armpit, we have a room temperature of 28.4. so I would like to try it first, but before then we have a 25.5 room temperature, or that's the temperature at that moment. The thermometer, the digital thermometer, which is of the cable of the thermometer to the monitor, is given the reading that it is given 25, and it has gone increased to 26 degrees Celsius. So I have inserted it in my armpit, under the armpit, and you could see the temperature is reading, is increasing from 25 to 32 and goes on and on. So not to waste much time, I would like to still keep it there, and let's move on to other things. We'll come back. Now you can see the other port, which is the green one. So you connect that one, and that is the port of the leads. This is a 5 lead ECG, 5 leads ECG, and the port is green, coded green. So you set the green port to the green socket. So, and you could see an arrow. There's a arrow. That's the direction at which you insert the port to the monitor. So this is a 5 lead ECG monitor, and at the same time a patient monitor as well. So the leads, we have 5, as I said, and there's red, there's yellow, there's green, there's black and white. Currently the green lead is the F, then the white one is the C. We also have the black, which is the neutral, and the yellow, which is the left, and the red, which is right. And I will explain that later. The yellow, which is placed, so these are the 5 leads. These are the 5 leads: the red, the yellow, the green, the black, the white, and the black, and the red. So 5 lead ECG. Now the red is placed on the right chest, especially is at the right mid-clavicular, below the clavicle. The yellow also at the left mid-clavicular, left side mid-clavicular, whilst the red is placed at the right mid-clavicular, below the clavicle, above the nipple. The yellow is the opposite, the left mid-clavicular, below the clavicle and above the nipple. The white also is placed on the 4th intercostal space of the chest. fourth intercostal space of the chest. Now, the green is placed at the abdomen, that's the left abdomen, on the rib, whilst the black is placed the right abdomen on the rib. So the green and the black and the green are placed on the abdomen, but the black and the green are placed on the abdomen, on the rib, right and left respectively. So these are the 5 leads ECG. So as I said, the black, the green, they are all placed at the abdomen, lower abdomen, but on the rib. The yellow and the red are also placed on the below the clavicle, mid-clavicular. The yellow and the red below the clavicle, mid-clavicular. That's the yellow and the red, left and right respectively. So this is the 5 lead ECG, and it's indicated on the leads. You can see red, black neutral, C chest, which is white, green on the right, the left foot, the left abdomen, and the yellow, which is also on the so that is that for now. Then we also come to, so currently you can see now the temperature, my temperature is 36.4. 36.4. The temperature now, my temperature now is 36 point, and you see it's 36.4. Okay, thank you. Now we are also going to look at, after the leads, the 5 leads, these are the electrodes, or some call it the sticky dots, that it's used, placed on. Before then you have to take it, or you open it, the leads are in, and you place them on the positions on the abdomen and the chest, as I indicated. The below the clavicle, mid clavicular, above the nipple, and also, so it's between the nipple and the clavicle, but mid clavicular is placed there. Then that's both right and left clavicular line. Then also the lower, that's the right abdomen and the left abdomen on the rib, and the white one, which is placed on the chest, that's the 4th intercostal space. So those electrodes are placed. Then before you hold them with this leads, it's a form of pegs. You open up, you press and open, then you attach it, then you leave it, and it will grip, it hold it. So that's how these leads are applied or attached to the electrodes, which are also called the sticky dots. Now, so the leads also, when you apply it, it does not give you only the heart rhythm, but I also give the respiration. Now we are coming to the pulse oximeter, the pulse oximeter. This is the pulse oximeter. Now this is how it is. First of all, when you find it, this joint, you look at its form of a trapezoidal shape. So you connect, that's the first spot, you connect it to the monitor. Then there's another adapter which holds the pumps, the one we connect to the the finger, the thumb. It's also just like the one connected to the monitor. You connect the two, you close to hold it. When you're done, then you insert your finger, either the thumb or any appropriate finger, into it. So as you see, you can use either your middle finger or your index or middle finger. So you can see current, as I inserted, it is not reading, but with time, and it depends, there are certain factors that can delay this. When the patient is very cooled, and currently we are in the ambulance and with the air conditions, it will take some time. Now you see it started reading. My SpO2 now is 98 and my pulse rate is 87. So it has, you could see the pulse oximeter is giving both the oxygen saturation and also the heart rate as well. And it is the same as the heart rate at the top, at the green region. So my SpO2 currently is 99 and my pulse rate is 80 or 75 and 75. So you can compare the heart rate at the green region and the sea blue region. They are of the same, 70, 85 and is 85 also there, both. Yes, they are of the same. Now, so this is the SpO2. This is the pulse oximeter, patient pulse oximeter, which is connected to the monitor. So just as you connect the leads, also you connect the monitor and the pulse oximeter to the patient, and whilst the leads are giving the respiration, the pulse oximeter also give you the pulse and SpO2 as well. Now our next thing is the BP. The BP. This is the cord, the BP cord or the connector. Now most of the times it's the joint. So first of all, this is, you connect the cuff to the connector. So both ends can be used to the cuff or to the monitor. Both ends can be connected to the cuff or the monitor. So you first connect the connector to the cable to the monitor, and it's a metallic lock. As you insert it, you push it in and it interlocks. Then you connect the BP cuff to the connector. Also, when you check the BP cuff, there is a direction or an arrow which points downwards. You should always make sure that arrow points towards the breaker artery. It should point towards the breaker artery. So you point, make sure as you fix the cuff on either hand, that part points or in line with the breaker artery. So when you're done, you just look at your screen, NIBP, then you touch or you press for it to start inflating. You touch for it to start inflating. You can also use the knob. You can also use the knob, but you just look at, then you just press NIBP, then the cuff will start inflating. So you will feel, definitely you can see now it is getting hardened. The cuff is now getting hardened, and when you look on the screen, you could see the MAP, the mean arterial pressure, will be reading or reading the mean arterial pressure will be reading until both. Yes, so currently the BP I got is 131/81. That's the systolic is 131, the diastolic is 81. And it's also because I'm standing and also active, that's talking. I wouldn't get the actual or the accurate BP. When I sit or stand, your posture and the activeness or whatever you are doing have effect on the pulse or the blood pressure. So, and you can use this white knob also to select and also activate any of the items or icons that is displaying at the toolbar. The white knob can be used. You rotate it, you tune it either clockwise or anti-clockwise to make or select any icon you want to work on. So just as that, I select the NIBP, then I press the knob, then it starts inflating just as I press on the NIBP. So you could see I am sitting and my BP, I'm checking my BP. Initially I had 131 for systolic and 81 for diastolic whilst I was standing and talking. Now I am sitting. Now see the mean arterial pressure is also reading. Now as I sat, I had 114/72. So you should always bear in mind posture and activeness of a patient can give you a wrong or a true state of the patient's blood pressure. So always you calm a patient